Good evening, everyone, and welcome back to Gen Z Unfiltered. As always, I am here today with Amrit and Simrit. Hi, guys. Hello. So, as you might remember, to our viewers as well, a while back we did an episode on body image, which received tremendous support from everyone. We got over 2,000 views. And if you haven't already watched it, the link is in the caption. So, today, the topic that we're talking about branches off of that conversation. And today's topic is eating disorders. So, did you guys know that 1 million Canadians have been diagnosed with eating disorders? That's a stat I pulled directly from the NIED, National Initiative for Eating Disorders website. And to add to that, about 26% of those affected attempt suicide. These are really disheartening facts, but nonetheless, they are an unfortunate reality of the world. So, to give us a deeper insight into the eating disorders world and how we can recognize signs of them, we are joined by someone very special, our expert guest, Dr. Gurkirti Brar, who practices medicine in Edmonton, Alberta, and she completed her BSc here at University of Calgary. She followed med school and completed her residency in family medicine at University of Alberta. So please welcome Dr. Brar.
Thanks for
having me. How are you?
I'm doing good.
It's a pleasure. We're good as well. And it is a pleasure to have you here. Like a huge thank you for being here because I can't imagine it being easy to take time out of your really busy day. So thank you so much.
It's my pleasure.
So first things first, how would you define eating disorders and how is it a conversation separate from body image?
Yeah, so body image is simply your feeling about your body, how you've perceived your body to be. And it doesn't have to be pathologic on its own. The feelings about your body can be positive and negative. However, repeated negative self-talk and messaging can increase your dissatisfaction with your body and lead to more negative body image, which can then in turn lead to behaviors that we see in an eating disorder. An eating disorder is something that negatively affects a person's physical health and their functioning.
Wow, that's interesting. What would you say are the most common types of eating disorders?
So the three most common types are anorexia nervosa, binge eating disorder, and bulimia nervosa. And I'll get into a little bit of detail about this, but you may have heard about some of these terms. So anorexia nervosa is typically a distortion in your perception about your own body weight or your body shape. People with anorexia nervosa tend to severely restrict their energy intake and tend to be underweight. Due to this perceptual disturbance in their understanding of what their body looks like to them, they can often be in denial about the medical consequences of their low weight, and they can be very afraid of gaining weight, and they will try and lose more and more weight despite being underweight already. The second kind that we talked about, the binge eating disorder, is where you may see episodes where someone may feel a lack of control in their eating. They can't stop eating or control the amount of what they're eating. They may consume a food in a large amount than most people would in that given time frame. They tend to eat quickly, and they may eat even when they're feeling physically not hungry. The eating can get out of control, and they may feel embarrassed after this episode is complete. So they can often feel disgusted or depressed at the end of one of these episodes as well. And then the last type is bulimia nervosa, where we see episodes of binge eating, but then after the episode is done, the person may try to do behaviors to counter the energy that they've kind of consumed. And these compensatory behaviors can include things like self-inducing vomiting, misuse of medications or laxatives to try and lose the weight, or excessive amount of exercise to also keep that weight balanced.
Okay, thank you for that information. Would you say there are specific eating disorders that affect certain age groups, or do eating disorders usually affect everyone?
Right. So eating disorders can happen in any age group, gender, ethnic, or racial group as well. However, the median age for binge eating disorder tends to be younger. So for binge eating, it's 23 years, and for anorexia and bulimia, it's around 18 years. And although much more common in females, about 10% of the cases will happen in males as well.
What usually causes these disorders? Is it something genetic, psychological, or are they caused by outside cultural influences?
Yeah, so I think all these factors definitely play a role. Genetics, family distress, other social and environmental factors can contribute to developing an eating disorder. We know that some people are genetically more likely to develop an eating disorder. This means that we shouldn't blame or be quick to judge those that are affected. There's a lot of stigma associated with eating disorders, and this can keep people from getting the help they need. But not knowing that this is not their fault might make it easier for some people to reach out and ask for help, especially when they feel supported and accepted first by their peers and their family. Family distress, or this part of the social situation, is possibly one modifiable risk factor to look at. We could possibly change certain practices in our homes then to try and reduce the risk of developing an eating disorder in our loved ones. So family characteristics that are associated with eating disorders include high perceived parental expectations for achievement or your appearance, families who communicate poorly, have members who are estranged from each other, where the maternal role or the role of the mother is devalued, where there's marital tensions, or families that have difficulties in managing conflict will all have a higher risk of seeing someone they love possibly developing an eating disorder. Also other risk factors like a history of sexual abuse, a history of dieting, an obsession with a thin body, and social pressures around weight. Lastly, some athletic and even artistic endeavors like running, wrestling, or ballet that emphasize leanness, and sports where scoring can be partly subjective, like skating or gymnastics, can be associated with a higher chance of developing an eating disorder.
So, Dr. Brar, what are some signs that can be used to recognize eating disorders, and how can one best support someone they know that is suffering from it?
Eating disorders can be difficult to detect because patients can be in denial or feel ashamed and try to hide it. Some clues to look out for could be greater than expected dissatisfaction in someone about their weight, large fluctuations in their weight, and depressive symptoms. Dealing with an eating disorder that's undiagnosed for a long time can take its toll on physical and mental health, and it can make it harder to overcome. So it's better not to put this off too much if you recognize the signs. So if you suspect that you may have an eating disorder, it's important that you reach out to somebody you trust or your family doctor. We're here to help. If you suspect someone you know may be affected, it's important to speak up and bring up your concerns to them. Offering your support can go a long way in helping them feel encouraged to seek treatment.
What do you think that parents, especially in like the South Asian community, who may be watching this right now, what can they do to address their children?
So with regards to prevention, we all stand to gain from promoting open and respectful communication in our households, to value the maternal figure, the maternal role, to learn to deal with conflicts appropriately. Also being mindful of our expectations from our children, especially when it comes to commenting on their appearance. Encouraging time outdoors by modeling this behavior yourself. Go out, get active, cut down time on the screens. When children see you modeling this behavior, they're more likely to follow. Where possible and based on interest, help children engage in after-school activities that help to build self-esteem and a better sense of self and keeps them occupied, really. When dealing with a loved one you suspect that may already have an eating disorder, first start by explaining why you may be concerned. Refer to specifics in a situation that you may have seen or behaviors you've noticed, and talk about why those behaviors may worry you. Try to avoid to lecture in a way or criticize, because then it may make the person defensive. So you don't want to have necessarily a solution to the problem, but just letting them know of what you've noticed or your concerns can be a good way to start. And letting your loved one know that you're meaning to help and it's coming from a place of love is also important. Second, if your loved one becomes defensive or angry, it's important not to take it personally, and that to stay focused in that conversation, to stay respectful, because it can feel quite threatening to somebody when they feel like there's a behavior that may have been hidden becomes apparent to someone around them. It's good to ask the person if they have a reason for wanting change. A question that might be helpful is to get them to answer what benefits they may perceive from expecting to change their behavior. What benefit would they get from it? In general, just being patient and supportive can go a long way. It may take some time before the person is willing to open up, admit to having a problem, and then reach out. But through this course, if you remain non-judgmental, even if the person sounds out of touch, and emphasize that you believe in them and that you'll be around when they're ready to deal with this on their time, it may make it more likely for that person to feel comfortable in getting the help that they need.
Okay, yeah, that's some really good advice. I'll keep that in mind as well. And so our last question for me is, what impact do you think social media has on eating disorders, and how can that impact be prevented?
So children and adolescents are flooded with mass media, as you guys probably already know, in terms of television, films, videos, billboards, magazines, and social media. On average, a child or adolescent watches up to 5 hours of television per day and spends on average about 6 to 7 hours viewing other medias combined. And these are pre-COVID stats, and we know through a recent survey that parents believe that 63% of the parents believe that overall their children's intake with some of these media avenues has increased during COVID. So we consume a lot of this information. We don't have direct evidence that social media is causing eating disorders, but we do know there is evidence linking this to obesity, increasing depressive symptoms, and a poorer quality of life, meaning we're not living up to our life potential when we're spending a lot of time on social media. We know media has a strong influence on a person's body dissatisfaction, their eating patterns, and also a poor concept of self. Individuals can begin to constantly compare themselves to thin models or people they may know, and other famous social media users, and start to feel inadequate, like they're not enough, especially about their self-image. So that takes us back to that negative concept of your body image. So there's this constant peer pressure surrounding this ideal body type then that develops. And thanks to just how pervasive social media is, individuals now everywhere can give you an opinion about your body, and they have something to say. And so body shamers kind of get involved. And so all this can take a big toll on emotional well-being in an individual who may already be struggling with their relationship with food. So to answer the second part of your question, how do we go ahead and how do we minimize the damage that might be coming out from these sources? Well, we have to be very selective in the information that we choose to consume. Choosing media that uplifts you, builds your confidence, and builds self-esteem is important. And so might be unfollowing or muting people that make you feel bad or not so great about yourself. So checking in with yourself constantly and seeing where you are is an important way to do it. In general, we do still want to limit screen time and social networking time, especially before bed, because it can affect your sleep and your thoughts going into sleep as well. Being intentional with your social media platforms and knowing that they're designed to be addictive. And so you really do have to stand up for yourself and fight for your time and be protective of that time. You can use a timer or check your screen time reports to kind of stay a little bit better in touch about your usage. It's also important to verify the source of the information that you're consuming. Are the body asking your questions like, are the body depictions realistic? Are the images perhaps digitally altered? What message are you really getting from a certain commercial or certain post on Instagram? So these are questions you want to ask yourself with every exposure that you might be getting, to be more mindful of what you might be consuming. And also important, before you text or tweet out or share information, who do you want to reach, and what message are you really sending out, so that you're not one of the ones adding to the problem, being more aware of what you're doing. In general, media can be used as an important tool as well, just like this, as health promotion and to come up with prevention strategies. So let's advocate for positive body talk, using social media to inspire others to use their voices. And you can use that to criticize unrealistic body ideals when that's put out, to report body shaming, to send positive messages to media outlets who are trying hard to negate some of these messages, to retailers, to advertisers, even to celebrity product endorsers who might be creating a more natural look or a healthy body size. So overall, you can make a difference by some of these measures. And lastly, I think, and more importantly, I think the biggest thing to remember is it's important to be kind to ourselves and to those around us to try and make a difference.
Wow, thank you so much for all the information and the insight, as well as the knowledge that you've given us today. I know for myself, hearing some of these facts was very heartbreaking, and just we can't even get a sense of what some of these people are going through, which is so unfortunate. So thank you for sharing your knowledge. As I know, and I think I speak on behalf of Amrit, Simrit, and our viewers when I say I've learned a lot. So thank you for that.
Yeah, thank you for having me. My absolute pleasure.
It was a pleasure having you. And to our viewers, thank you so much for watching. We will be back with another episode of Gen Z Unfiltered next Wednesday. And thank you so much for supporting us. It means a lot to see that we can make at least the slightest bit of an impact. Now, unfortunately, Amrit and Simrit both had a bit of technical difficulties. So on behalf of them, peace out.